Okay, the next thing we're going to be doing in the examination is we're going to be assessing the abdomen. And the first thing I'm going to do is ask her some questions. I'm going to ask her, has she had any abdominal pain? Have you experienced any abdominal pain, Ms.
No,
Washington?
no,
What about any abdominal tenderness?
no,
Okay, have you had any nausea or vomiting
no,
or diarrhea?
no,
You haven't noticed any blood in your stools or anything?
no,
Okay, you had good appetite, been able to eat?
yes,
Okay. Well, the next thing I would do is first thing I'm gonna do is I'm going to inspect her abdomen because in this assessment, the everything we change things around a little bit. The first thing we do is inspect, and then we auscultate, and then we do percussions and palpitations. We save those for last because we don't want to put the patient in any pain before we even initiate the examination, and we don't want to stir the bowel sounds up too much. So the first thing I'm going to do is inspect her abdomen. The first thing I'm going to be looking at is I'm going to be looking at the contour or the shape of her abdomen. Her abdomen appears to me to be rounded. It doesn't appear to be scaphoid or protuberant. I'm looking also at the symmetry of her abdomen. Her abdomen is symmetrical to me on both sides, right and left, top and bottom. And the next thing I'm going to look at also is I'm going to look at the skin on her abdomen. The color is it's all even. There's nothing that appears to be infected or swollen or inflamed. And I'm going to notice, particularly around her umbilicus, I'm going to be looking for I don't see any bulges or masses or anything around her umbilicus. I'm looking around her umbilicus to make sure I do not see any umbilical hernias or anything like that. I don't notice any movement or any pulsation going on in her abdomen. As far as hair distribution, just for privacy, we're not going to go there. I just know that in the female, the appearance of the hair or the hair distribution, the pubic hair is kind of like an inverted triangle. And I'm just looking at her demeanor. She looks comfortable. She doesn't appear to be in any pain or anything. And the next thing I'm going to do is I'm going to auscultate her bowel sounds. I'm going to listen to all four quadrants. I'll be starting at the right lower quadrant. Then I'll go to the right upper quadrant. Then I'll move over to the left upper quadrant and the right lower quadrant. And I'll be listening for maybe 5 to 10 seconds in each area. Okay, she does have good bowel sounds, and they do not appear to be hypoactive or or hyperactive. They appear to be normal to me. And the next thing I need to assess is I need to assess for any bruits. And to do that, I would flip my stethoscope because I'm going to use to assess for bruits. You've got to use the bell. So I'm going to flip the stethoscope and I'm going to be assessing for bruise. But first, I'm going to assess the areas where the arteries are. First place I'll be looking. Um, I'm going to be looking at the aortic artery. I'm going to go be assessing in that area rather, and that to assess for the aortic artery is a little bit below the xiphoid process and above the umbilicus. So I'm going to listen in the aortic area with the uh, bell of the scope. And then I'm going to move down just a little bit, not very far, to assess the renal arteries. I'm going to do the right renal and the left renal, and just moving down just a little further from the aortic. Then I'm going to move down just below her belly button, and I'm going to assess the right and left iliac. These will be right below her belly button. Okay, and I don't hear any bruise. I don't hear any swishing sounds or anything going on there. And while I am assessing for bruise, I'm going to backtrack and I'm going to go back up and assess her carotid arteries in her neck area, the neck vessels. I'm going there and I'm going to assess for a bruise in the carotid arteries using the bell of my stethoscope. Okay, I don't hear any swishing sounds or bruise in the neck vessels either. And the next thing I'm going to do now, now that we've inspected and we've auscultated, I can now go ahead and percuss the abdomen I'm going to percuss all four areas and kind of warm my hands. And I'm going to be percussing clockwise for tympani. Okay, and I just did it clockwise, and then the tympani is that's normal. The next thing I'm going to be assessing for is costo. I'm going to assess the for costovertebral tenderness. So I'm going to have the patient sit up. Can you sit up for me? And we're going to turn her back to the camera. And for privacy, I'm not really going to lift her shirt, but I know that we're assessing the kidneys is what we're doing. So we go to the back, we're at the back, and we're going to go to the costovertebral angle in the back. We would palpate down to the 12th space here, and you're going to put your hand over that area, and you would take the fist, the ulnar part, and you would just kind of lay your hand here, and you would just kind of do that, and you would come to this side, and if you did that, if a person had a pyelonephritis or any kind of kidney infection, she would immediately respond to that pain. Okay, the next thing I'm going to do also, I'm going to palpate, I'm going to do deep, I mean, light palpation, deep palpation. So I'm going to have patient lay back down for me. Go it down a little. With light palpation, I'm just going to go about 1 centimeter. And I'm going to use my 4 fingers put together here, and I'm going to go in a clockwise position. I'm asking the patient if she feels any pain or tenderness as I go, starting clockwise. Okay, you feel any pain or tenderness there?
No.
Okay, what about here?
No.
Here?
No.
Here?
No.
Okay, and then I'll go ahead and do deep palpation, which is it's a little bit deeper, so I'll go maybe like 4 or 5 centimeters deep for that. I'll just go clockwise also. You feel any pain or tenderness?
No.
Not here.
No.
Here?
No.
Here?
No.
Okay, and while doing that, I did not feel any masses or tumors or enlarged organs. The next thing that I will assess for is rebound tenderness. Um, if the patient had any complaints of any um, pain in her abdomen, what I would do, say if she had pain, um, you especially use this, especially if you were suspecting appendicitis or anything. But if she complained of any pain in her abdomen, say if it was the right uh, lower quadrant, I would take my hand and go at a 90-degree angle, and I would come to this side, and I would go at a 90-degree angle, and I would press deep down. And the trick is to bring my hand back up quickly. And when I do that, if there's rebound pain, she should feel that. Feel any pain?
No.
Okay. And the next thing I'm going to be assessing is what we call the Murphy's sign. And what I'm really looking for is I'm trying to make sure that she doesn't have any cholecystitis or infection in her gallbladder. So I would just keep her as she is. And I'm going to come down. I'm going to come down maybe, and I'm going to come down to right mid-clavicular area here, just at the top of the liver. And I'm going to take my hands and I'm just going to palpate right here. And I'm going to ask the patient to exhale for me. Can you exhale, blow out? Okay, can you inhale for me? Now, if the patient had any type of if gallbladder infection, she would not be able to continue the breath, and I don't notice any of that. So that's rebound tenderness and the Murphy sign, and that's the end of the abdominal exam.